Welcome to our Rebornation channel. Today we're diving into a crucial topic, the top 10 early warning signs of liver disease. You should never ignore. Your liver is a vital organ, working tirelessly behind the scenes to detoxify your blood, process nutrients, and fight off infections. Because it's such a workhorse, we often take it for granted until something goes wrong. Recognizing the early signs of liver distress is crucial. The earlier we catch any issues, the better the chances of successful treatment and management. We're talking about empowering you with the knowledge to take control of your health. So let's break down these warning signs, understand what to look out for, and most importantly, learn how to take action. #1, let's talk about jaundice. A yellow tint to the skin or eyes indicates a buildup of bilirubin, a substance the liver normally processes. This is a classic symptom of liver trouble. That's because of a pigment called bilirubin, which is produced when old red blood cells break down. Normally our liver filters out bilirubin, but when the liver is struggling, bilirubin can build up in the bloodstream, and that's when you might notice a yellowing of your skin and the whites of your eyes. This yellowing, known as jaundice, isn't always obvious at first. Sometimes it starts subtly, maybe a slight yellow tinge that's more noticeable in natural light. It's not just about the color change either. Jaundice can also cause your skin to feel itchy. Now, jaundice can be a symptom of other conditions too, not just liver problems. But if you notice this yellowing, especially if it's accompanied by other symptoms we'll be discussing, it's crucial to get checked out by a doctor. Remember, early detection is key. Don't brush it off as nothing, thinking it will just go away on its own. Your health is worth investigating. Let's move on to the next sign. #2, our next warning sign, is all about your gut feeling, literally. We're talking about abdominal pain and swelling, particularly in the upper right abdomen, right about where your liver is located. Now, our abdomens are complex areas, and not all pain points directly to the liver. But persistent pain or discomfort in that specific region, especially if it's a dull, aching pain that lingers, shouldn't be ignored. Along with the pain, you might also experience bloating or a feeling of fullness, even if you haven't eaten a large meal. This can be due to fluid buildup in the abdomen, a condition known as ascites, which can be a sign of advanced liver disease. Again, I can't stress enough the importance of listening to your body. If you're experiencing unusual or persistent abdominal pain, don't try to tough it out. Get it checked out by a healthcare professional. They can determine the underlying cause and recommend the appropriate course of action. Remember, early diagnosis and treatment can make a world of difference. #3, we all feel tired from time to time, right? Life can be exhausting, but we're not talking about your average end-of-the-day fatigue here. We're talking about chronic fatigue, a persistent, overwhelming tiredness that doesn't seem to go away, even after a good night's sleep. When your liver isn't functioning optimally, it has to work harder to perform its essential tasks. This can lead to a buildup of toxins in the bloodstream, which can contribute to feelings of fatigue and low energy levels. Think of it like this: your body is like a well-oiled machine, and your liver is a key component. When the liver is struggling, the entire system can feel sluggish and run down. Chronic fatigue related to liver problems can also manifest as difficulty concentrating, muscle weakness, and a general lack of motivation. If you're constantly feeling drained despite getting enough rest, don't just chalk it up to a busy lifestyle. It's essential to consult with your doctor to rule out any underlying medical conditions, including liver disease. #4, nausea or vomiting, more than an upset stomach. Now let's talk about nausea and vomiting. We've all experienced an upset stomach at some point, whether it's from something we ate or a stomach bug going around. But when nausea or vomiting becomes a recurring issue, it's important to pay attention. You see, the liver plays a crucial role in digesting food and filtering waste products from the blood. When the liver is inflamed or damaged, it can disrupt these processes, leading to feelings of nausea and even vomiting. If you're experiencing frequent bouts of nausea or vomiting, especially if it's not related to a known cause like the flu, it's important to consult with your doctor. They can assess your symptoms, perform any necessary tests, and determine the underlying cause. Remember, addressing the root of the problem is key to feeling better. #5, loss of appetite, when food loses its appeal. Have you ever noticed that when you're not feeling well, food just doesn't seem as appealing? Well, a sudden loss of appetite can actually be an early warning sign of liver disease. When your liver isn't functioning properly, it can affect your digestion and metabolism, making it harder for your body to process food and absorb nutrients. This can lead to a decreased appetite and even unintended weight loss. Now, it's important to distinguish between a temporary loss of appetite, like when you have a cold, and a persistent disinterest in food. If you're consistently not feeling hungry or find yourself eating significantly less than usual, it's crucial to bring it up with your doctor. They can help determine if there's an underlying medical condition, such as liver disease, that needs to be addressed. #6. Dark urine, a telltale sign. Let's talk about something we all do, something we might not think twice about, going to the bathroom. But did you know that the color of your urine can actually tell you a lot about your health, especially when it comes to your liver? Normally, urine ranges in color from pale yellow to amber, depending on how hydrated you are. However, if you notice your urine consistently looking darker than usual, almost like the color of dark tea or cola, it could be a sign of liver trouble. Remember that bilirubin we talked about earlier? When the liver is damaged, it can't remove bilirubin from the blood effectively, and this excess bilirubin can end up being excreted in your urine, giving it that dark color. Now, I know it might seem a bit strange to be paying close attention to your pee, but trust me, it can be a valuable indicator of your overall health. If you notice any significant changes in the color, smell, or frequency of your urination, don't hesitate to consult with your doctor. #7. Pale stool. Don't flush away this clue. Okay, I know this might seem a bit awkward to talk about, but trust me, it's important. Just like the color of your urine, the color of your stool can also provide valuable insights into your liver health. Normally, stool ranges in color from light to dark brown. However, if you notice your stool looking pale or clay-colored, it could be a sign that your liver isn't producing enough bile, a digestive fluid that helps break down fats. Bile is what gives stool its characteristic brown color. When the liver is damaged, it may not be able to produce or secrete enough bile, resulting in pale or clay-colored stool. I know it's not the most pleasant topic, but it's crucial to be aware of these changes in your bowel movements. If you notice any significant or persistent changes in the color, consistency, or frequency of your stool, don't hesitate to consult with your doctor. #8. Itchy skin, more than just dryness. We've all experienced itchy skin at some point, whether it's from a bug bite, an allergic reaction, or simply dry skin. But did you know that persistent itching, especially if it's not relieved by lotions or creams, could be a sign of underlying liver problems? Remember that bilirubin we talked about earlier? When the liver is damaged, it can't remove bilirubin from the blood effectively. And this excess bilirubin can build up in the skin, leading to intense itching. This itching, known as pruritus, can be widespread or localized to certain areas of the body. It can be incredibly uncomfortable and even interfere with sleep. If you're experiencing persistent itching, especially if it's accompanied by other symptoms of liver disease, it's essential to consult with your doctor. They can determine the underlying cause and recommend appropriate treatment options. #9. Swelling in the legs and ankles, fluid retention. Have you ever noticed your shoes feeling a bit snug at the end of the day, or maybe your socks leaving indentations on your ankles? While this can be normal after standing or walking for long periods, persistent swelling in the legs and ankles, also known as edema, can be a sign of underlying health issues, including liver disease. The liver plays a crucial role in regulating fluid balance in the body. When the liver is damaged, it can disrupt this balance, leading to fluid retention, especially in the lower extremities. This swelling can be painless or accompanied by discomfort. It's often more noticeable in the evening after you've been on your feet all day. If you notice persistent or worsening swelling in your legs, ankles, or feet, it's essential to consult with your doctor. They can determine the underlying cause and recommend appropriate treatment options. #10. Easy bruising or bleeding, blood clotting issues. Bruising easily or bleeding more than usual can be a sign that your liver isn't producing enough clotting factors, proteins that help stop bleeding. The liver is responsible for producing most of the clotting factors your body needs to control bleeding. When the liver is damaged, it may not be able to produce these clotting factors effectively, increasing your risk of easy bruising, prolonged bleeding from cuts or scrapes, or even internal bleeding. If you notice that you're bruising more easily than usual, or if you experience any unusual bleeding, it's crucial to consult with your doctor. They can assess your symptoms, perform any necessary tests, and determine the underlying cause. Finally, your liver, your health, take action. So there you have it. The top 10 early warning signs of liver disease you should never ignore. Remember, your liver is a vital organ and taking care of it is essential for your overall health and well-being. If you notice any of these signs, it's important to consult with a healthcare professional as soon as possible. Early detection can make a significant difference in managing liver disease and preventing further complications. Don't forget to like, share, and subscribe for more health tips and information. Stay healthy.